So our first major keynote for the day is Professor Rebekah Russell-Bennett. Rebekah is the co-director for the Centre of Behavioural Economics, Society and Technology at the Queensland University of Technology, and her talk today is around the case for strengths-based approach to customer vulnerability. I'd like to welcome Rebekah to the stage. Rebekah will provide a presentation, and then at the end of that presentation there will be time for questions. So as you think about what Rebekah is saying, please jot down your questions and then we'll feel free to ask them at the end of that presentation. Thank you, Rebekah.
Okay, well, good morning, everyone, and greetings from wet Queensland. So it's really nice to come to Melbourne, where I actually didn't need my umbrella. So that was great. I've got a QR code up here, which takes you directly to the project page of the case that I'm going to give you. So if you're interested, please scan that QR code. And I've also left some hard copies of 2 journal articles that relate to this topic as well on the registration desk. If we run out, you can just send me an email. There's only one of me apparently on the internet, so you should be able to find my QT email pretty quickly. So just shoot me an email if we run out of those hard copies, because they are behind a paywall, so you may not be able to access them. Okay. So, BEST. So we're the best centre at QUT, the best centre in Australia. So the Centre for Behavioural Economics, Society and Technology, and the acronym is actually purposeful. And the centre brings together multidisciplinary approaches across the university, all in the behavioural space. And so the project that I'm going to show you very much taps into it. And I think this is because the work that I do in social marketing and in transformative service research really requires multidiscipline approaches. So I work in the areas, in a variety of areas, including public transport, energy efficiency in the home, preventative cancer screening, uptake of biomedical technologies, safe sex, any topic area that you can think of that really requires that behaviour change is a place space we play in. But I'm not a domain expert. And so if I'm going to work in these fields, or I'm going to work in the area of respectful relationships, I don't pretend that I know everything on it. So we always work with the domain experts, both within the university, but more importantly, with people who are actually out working with these populations. And so our centre basically cuts across all of those areas, with a particular emphasis in health, education, agriculture, and digital. And so, like most organisations, we've arranged ourselves around a process. So this is the best idea. So the I is insight, the D is design, the E is evaluate, and the A is achieve. And so we do everything from identify barriers, sort out what the problem actually is, right through to working with policymakers to implement what we're recommending. So that's a bit about what we do. So humans like to sort and classify. So this is how our brains work. We're hardwired to sort of look at a situation, assess it, and put it in a box mentally. But the problem with this is that there are biases that often underpin that thinking, and those biases can lead us down a path that is not necessarily helpful. But it is part of who we are as human beings. And so being aware of how we think and our biases is a really important part of being able to change and adapt to different circumstances. And so one of the things that we do is we tend to label people. So we look at someone and, they're wealthy, or they're not wealthy, or there's somebody I want to talk to, their friend, their foe. And the problem with this is that we tend to then place the condition first that is usually visible. And so we use terms like homeless person or drug addict, and they're labels that we then assign. And I'm going to get to why that's a problem. The alternative is that we could label the situation that person is in. So instead of saying a homeless person, we'd say a person experiencing homelessness. And this is called person-first language. I guess one of the reasons we don't do that is it's a bit of a mouthful, right? It's easier to say homeless person than it is to say a person experiencing homelessness. And we do the same thing with the vulnerability language. We say vulnerable consumers. We say vulnerable populations, vulnerable groups. And in doing that, we're actually labelling the person. Rather, what we should be saying is a person experiencing homelessness or vulnerability, or a group experiencing vulnerability. I'm going to get to why that language is important, and it is a mouthful. There's just no two ways around it. But language really matters. And I'm going to show you or tell you about some of the empirical evidence that demonstrates why this language matters. The caveat there is, however, some communities do actually prefer to put the identity or condition first, so it's really a matter of be aware of what language is appropriate for your audience. But in general, if you don't know, then label the situation, be person first. Okay, so what's in a name, to quote Shakespeare? Well, we know language is really important. It does frame policy support. So there's been some really good research by some American researchers who showed that when we use person-first language, i.e. a person using drugs or a person experiencing homelessness, people are less supportive of punitive policies, and the reverse applies. So if I label someone as a homeless person, then there is evidence that people are more likely to support a penalty or blaming that person. It's reflective of our unconscious bias and our underpinning belief structure. So that simple change of language actually shifts people's beliefs, which I think is really, really important. And we see this with the media. So if you want people to be outraged and you want people calling for harsher sentences or punitive measures, then just label the person. Call them a homeless person, call them a drug addict, and then watch the media frenzy, watch the social media frenzy. And then, of course, politicians are often reactive to populist sentiment and to media. So if you want to shift the narrative in policy, we have to shift the narrative in the way that we operate, and then that eventually will become part of a broader narrative shift. There's a US non-profit organisation, the LISC, that actually has a whole bunch of guiding principles, and they say terms to use and terms not to use. But when I looked at this, I said, that's great that they're going person first, but actually that's deficit language. It's still focusing on the negative, and it's still assuming that people lack something. So I started to think about this. Why is it that we default to loss? And working in a centre for behavioural economics, loss aversion is a pretty common bias that we look at. In social marketing, there's a lot done around message framing and around whether or not we should use shock tactics, the Grim Reaper kind of campaigns. So we know that human beings automatically default to loss. So given a choice or given an uncertain situation, we retreat. And this is, we call this loss framing as opposed to gain framing. And we know that with loss aversion, that people will take a behaviour to avoid a minor loss, even though they might gain something far more. So if they're faced with a choice of do this, lose $10 or gain 20, they tend to be more motivated by the loss rather than the gain. It's part of our hardwiring. And what it means is we need to be aware of that. We've all got this, and that we have to, when we're conscious of it, we can then do something about it. There's no real consensus about the way to manage message framing in the social marketing literature. There's been a lot of work done about threat appeals. They tend to work better with men than women for some reason. So you can scare a man into action, apparently. But in general, it's not that effective. And if you don't put a call to action, it's even worse. So scaring people with a tobacco ad and then not giving them a way of dealing with it actually just causes counter-argument in people's mind, and they'll turn the channel, say, that's not me, and they won't do anything about it. So there's a lot more evidence for more positive framing, the benefit that you'll get rather than the loss. So why is it so hard to think positively about social issues? Well, this is just my kind of 2 cents worth, although it might be 5 cents with today's cost of living. Biological survival, we're hardwired. We know this from the evolutionary psychology literature, that we have learnt to pay more attention to danger and act fast. And in acting fast, we make mistakes. There's also a mission and a role of government. Historically, the role has been paternalistic, to have power over others, typically to save themselves from harm or themselves. And the traditional role of government is enshrined in legislation as a protector and a provider. If you go and have a look at any Western government in particular's ethos or mission about what government is, you'll find words like a helping role, protector, rather than facilitating self-help or enabling people. So there's not a lot of agency terms, and it's a historical legacy. But, you know, if you've got that embedded in your very core, then it's pretty hard to shift from that. We know that we innately label people, so we have identity first language, and when we do that, a condition is viewed as permanent. So again, we've got experimental evidence to show that when we say, oh, someone's a homeless person, we see that as permanent and can't be changed, and they're responsible for it. As soon as we say a person experiencing vulnerability, immediately the belief structure changes. And I think that's quite remarkable that you can shift someone's belief structure simply with terminology. But again, there's extensive evidence in the psychology literature around this. And importantly, if we say someone's a homeless person, we believe it's the condition was in their control and that they're just not willing to change. And therefore, the responsibility for change then rests with them. And you can see then how the strategies would then follow that: government policy, public will. And so simply using different terminology starts to shift the narrative here. Now, I've got here a timeline, and I'm not sure how visible it is, but if people are interested in the timeline, then you can read the slides. So in marketing, which is my home discipline, vulnerability sort of first appears in about 1990, and it draws on an extensive history from other fields. But interestingly, it first comes out in the satisfaction and complaint literature, and it labels people as vulnerable consumers. And that term has been used consistently through marketing until recently. I've got to say, marketing picks up on ideas from other fields, and then it disengages with that field to then just keep going on its own, and then never coming back to that field to say, well, has that field actually changed? So often we end up going like this, and it's only when we go back to those parent disciplines to say, do they still do that? That we find actually they don't, and geez, maybe we need to shift. And so what I'm bringing to you now is really only something that's appearing in our literature and scholarship really over the last couple of years. But there's a long history in social science, in community-based work in health that actually is already there. So 87, we see the first approach to targeting strategies. What do we do to save these poor people? Then we see the first framework come out in 2005 that actually has some antecedents, some consequences, some market factors. And importantly, this is the first article that says, don't label the person. It's actually the situation. So let's say customers experiencing vulnerability, and this is the first time it appears. It takes us another 15 years before everyone actually does that, but it's there. 2010, there's a bit of an update on that framework. 2013, we then start to see the movement. Transformative service research kicks off, and it's really aligned with the explosion in social marketing. And so suddenly, these social cause kind of areas are no longer fringe. Suddenly, all marketers, commercial and government and non-profit, are all starting to understand that helping people and doing something for the planet actually matters. And so now this is a fairly mainstream sort of idea, but back in the early 2000s, it was still seen as pretty fringe. And then we see special issues coming out in 2017, and then coming to 2022, where we've got a new definition or a consensus definition of consumer vulnerability from a systematic literature review of over 300 articles. An excellent piece if you want to know the history in the marketing area. But what that article showed is that all previous articles were going from a deficit lens, that consumers were powerless, couldn't really do anything about it, and we needed to help them. And so myself with colleagues, and I can see our first author, Maria, sitting just down the front here, and Kate Leatheran's online. So we actually put together a different approach and posed a new definition. We broadened the term consumer to customer, so anyone involved in the process. Because when someone goes to hospital as a patient, they're not the only one involved in the process, they're not the only one making decisions. So they're the consumer of the medical service, but they're not the only customer, their family is. There's other people that are making decisions. So we use a broader term. You might use terms like client, interchange the word that is comfortable for you. And so we had a new definition that was really about susceptibility. So vulnerability is not a state of harm. And so I've really got to stress that. And we tend to use it for people who are already suffering. The word means likely or open to being wounded from the Latin. You are not yet in trouble, but you're likely. It's a susceptibility. Vulnerability is the antecedent state before harm. It's where we can do something about it before the harm occurs. And so we are using this term, I think, in practice interchangeably. So when people are in a crisis, we're saying they're vulnerable. No, they're not. They're already in crisis. They're way past that vulnerability stage. So if you think of preventative health, where we have the 3 stages of prevention, primary, tertiary, and secondary, and where we do breast screening and things like that on healthy people at that very early stage, and then we have a warning stage, and then we have a crisis stage, well, vulnerability is like that as well. So vulnerability is that, yeah, warning, but not yet. So we need to make sure that we're actually distinguishing between a state of vulnerability and a state of harm, because the strategies are really, really different. And so we take a strengths-based approach to vulnerability. So strengths-based is very different. Who here is familiar with the strengths-based approach in their field? Yep, a number of you. Okay, so we know that the traditional approach that is deficit focuses on what people lack, so they're powerless, homeless. The solutions are designed for them. Whereas with the strengths-based approach, we design with people. They've got capabilities that can be leveraged. We focus on what people have rather than what they don't have. When we look at the cycles of how this operates, the deficit cycle starts with what does the person lack? And then everything that comes after it is quite different to starting from a position of what do people have? What are their capabilities? What can they do? And it's incredible that people experiencing homelessness actually are incredibly resourceful people. They really are very, very savvy, and that can be leveraged so that they are able to be part of that solution. So the project I want to very quickly skim you through is the Women's Butterfly Project. So this is a project that started off as preventing homelessness. And that's where we started. And this was a real journey for us. This was where I had to really constantly check myself. We were checking in with the team constantly. We rewrote things I don't know how many times because implicitly we kept defaulting to deficit language. So this for me was my real aha moment of where I had to be really step up and be really conscious of my own bias. So we did older women. It was all about primary prevention, and we decided that we were involving organisations that were a major early touch point when women experienced a change of circumstance. The problem is these organisations weren't police or ambulance or doctors. These were people like real estate agents, banks, lawyers, and it's not their job to deal with helping people with housing, although real estate is, but it's not about helping people who might be facing a crisis. So how do you engage organisations whose job it is not to do whatever it is that you're engaged in? And one of those partners was actually Suncorp, and we've got Amanda, who was our industry contact on that. And we also work with Moreton Bay Council because we wanted to compare a tech approach using in-app alerts with face-to-face. And what we found is that women would go to council libraries to get help filling in forms, get advice. The role of libraries has significantly shifted, and during the pandemic it sort of did a major step up, and it's a real community hub now. It's not just a place for books. We had a very diverse, extensive research team, and so we have Joy Parkinson, who is one of the speakers today. She was also on the team. Kate is doing the online workshop this afternoon. Really diverse from the fields of social marketing, behavioural economics, design, justice, information systems. These kind of problems take a multidisciplinary approach, and so that's what we did. So we did a whole bunch of co-design. So we used the double diamond human-centered design approach. We did design workshops with expert proxies. So these were people who worked at the coalface, and some of them also had lived experience of having problems with homes. We did lots of iterations. We did lots of user testing. We ended up developing a portal of information. But what we didn't want is some static portal with, here's some information, go figure it out for yourself. So being human-centered, we developed personas. And so we used the metaphor of a butterfly, which really resonated with women. And so what we've got here is the health continuum, which implicitly has risk sitting behind it. But what we wanted to do is look at women, their likelihood of experiencing housing stress and how close they were getting to the edge. And so our amber persona was someone who experienced a change of circumstance, but she was never going to have any kind of housing problem. All the way to Delia, who was right on the edge. Now, none of them are experiencing harm yet, but their likelihood of harm is increasing. And so the challenge then for us was, how do we communicate with these women? How do we design this portal without using words like risk, without using words like homelessness? Because the Ambers of the world are never going to experience any kind of housing crisis. And so we had to make a landing platform that catered for women who are fine but still experiencing change, as well as the women who are not fine. We took the breast screen sort of Queensland approach of where you screen everybody in the hope of finding those people who are largely unaware themselves that there's any kind of problem. But you have to use a language that resonates with everybody. And that was where the strengths-based approach really came in. So we designed up a portal where they came in either via the in-app banking alert from Suncorp, or they walked into the council and we had posters, there were butterfly wings all over the place, we had a QR code, so we had a high-tech, high-touch way of generating traffic to that portal. And then we were able to assess the analytics, who came, who stayed, and I'm going to give you some of that data. So when they landed on the portal, it's a very welcoming page. It's very simple. We had some really clear design principles that we needed to adhere to. So when you're in crisis, or rather when you're in a change of circumstance, you've lost income, or a marriage breakdown, or your job's a bit precarious, you're not in the mood to have a really complicated website. So there are 3 menu items on here, and it's really simple. There are no cookies, so that you can close it down and no one can track you. So you land on the portal, you complete a persona quiz, which has got 10 questions. Some of them are just really kind of fun questions, what did you go to on a Friday night, just to be light touch and engaging. And again, remembering this is for the Ambers of the world, not just Delia. And you can go on and do this quiz yourself. When you've done the quiz, it sends you to a page that's curated for that persona, and that's again based on co-design work we did about what are the needs of each of these personas. So the most important wellbeing need for Amber was social, and so we had some links to various places she could go to get some social support. And we used the 5 elements of wellbeing to actually create the categories of the links. She's got all the wellbeing dimensions. They're in a different order to what Delia sees. So when Delia sees it and she's ready to she's potentially in trouble, what she needs most is financial. And so she goes to these financial sites. The idea was not to make it a comprehensive site, it was to test the concept of, can we work with first contact providers like banks and councils? And when we do, what do people do when they arrive? And is there any kind of stickiness? And I'll show you the results in a moment. What we did have to do was we had to come up with a glossary, and I'd really recommend this approach. What are the words you want to use? And that way your communications are clear. All of your reports are very clear. And so we had to develop a whole bunch of language taking out from deficit into strengths-based. And when we gave this back to the Department of Housing, who were the funders of this scheme, they said this was a game changer for them. And if you think about it, what is the logic of having a homelessness strategy? Shouldn't it be a housing strategy? No commercial organisation sets out to have a bankruptcy avoidance strategy. It's actually called a growth strategy or a sales strategy. So I would again challenge people, is the strategy is about what the outcome is that you want, not the outcome that you're trying to avoid. It shifts the narratives and it shifts the focus. I know it doesn't make for very good headlines in the newspaper, but it actually works. And we know that it works because we have the evidence for it. So what I would recommend to you is, here were the 5 project features that we had to reframe for a strengths-based approach. And honestly, if you saw some of our early versions, you'd cringe. We had to make an active decision to redo all our visuals, and that was time and money. And when you're on a pretty tight budget, that's a challenge. But in the end, we needed to do this. I think we're a lot better at catching ourselves now. So the project title had to change from preventing homelessness to being about maintaining secure housing. The design principles, we had actually labelled them as things like removing barriers. Well, actually, we now need to go from barriers to leveraging assets. We needed to change language in our persona profiles from words like risk and barriers. We had to then change the whole quiz because we'd made the same mistake. And we were labelling our tools on the website initially as resources. Resources is really economic, like classical economics language, and it treats people as objects and things. So we had to change the language to being about capabilities, which is a far more human-centred way of speaking rather than people as resources. So we had to reimagine the gain framing of social issues. So we had to reframe our issue, we had to rewire our brain and constantly be aware of our own biases. We had to relate to the client in a different way about capabilities. We had to revise our language, and a glossary is a really useful way of doing this. We had to redesign our method as we went through in order to keep catching ourselves. So there's a lot of everything in this process. When it came to evaluation, and this is where this was what Joy's fantastic contribution was, is we used the logic model of evaluation. There's a real tendency with programs to just measure clicks, likes, shares on websites and go job done. Well, no, it's not. That's nice to know. It gives you an indication of a level of engagement, but it doesn't tell you what you've actually done for the social issue. The logic model forces you to go further and look at impact, and that's what I really like. It comes from the US, the CDC. There's lots of stuff out about it. It's a great way of designing your evaluation. We had to design at the beginning to make sure that we had everything in place as we go. And it evaluates both the process as well as all of the outcomes, outputs, and impact. And so this is what we ended up doing. So we had a whole bunch of printed materials. That's great. Outputs were pretty good. We had good outcomes. So we had, I think we assessed it over a 6-week period. We had 1,100 users. What was great is the most popular persona that landed on our site was Delia. So we attracted the person who needed our help the most. And the stickiness of her stay on our site was also multiple times what everyone else was. The return on investment worked out to be about $129 per woman. If we were to scale this, that would come down a lot more. Now compare that with the cost of, I'm using the government term here, homelessness of $25,000 a person, and now looking at like $40,000. I think $129 is a really, really good alternative to this from a prevention point of view. And because this was it was a proof of concept, not a field trial, we couldn't go in the full control group impact analysis. But the anecdotal feedback that we got from doing interviews with people at Suncorp and at the council was that there were people who actually ended up in secure housing as a direct result of engaging with our program. And these are just the ones we knew of. So even if 2 women were helped, then the program was worth it. So in terms of what you can do, so how organisations can support causes from a strategic point of view, well, we came up with 3 sort of business models. We've got organisations that care. So this is the outer layer. So they're not directly aligned. They don't deal solely with the cohort, and it's not that part of their core purpose, but they're a supporting partner, right? That's important. Let me just go back. Then you've got the middle layer, organisations that can. So they come into contact with the cohort. It could be for non-cause related reasons. So it could be like banking or legals. A woman's going through a divorce. But they do something and they start to embed the processes actively in their systems. And then finally, you've got organisations that champion, and I'd say that's what Suncorp has done, particularly with our project, and you're going to hear a bit more about what they do, and certainly with Moreton Bay Council. They're directly aligned. The business clicks, and they can integrate cause support into their existing processes. And the thing about the Women's Butterfly Project we were very mindful of, and we did a service blueprint of, is that we didn't want to disrupt business as usual. We wanted to make it as easy as possible for organisations to partner with us. And so basically they didn't need to triage anybody, they didn't need to work out who was at risk, they didn't need to train up staff. All they needed to do was either have a conversation or do the electronic alert, and then we would do the rest. And that's what the portal does. And that made it, I think, reasonably easy as a business case to actually then get their involvement. That's our website. We've got over 45 different projects. We've got a curated collection specifically around customer vulnerability of projects and research articles. If you're interested, just scan that QR code. And thank you for your time. I think it's a question.
Thank you, Rebekah. Yes, I've got the handheld microphone with me. So
Pardon?
I've got the handheld microphone. So if you have a question for Rebekah, please put your hand up and I'll pass the microphone to you.
Thank you so much. That was amazing. So what's happened with the Butterfly Project now?
That's a good question. Yes, we are open for funding and open for partners. One of the problems with doing these sorts of things is, it was project-based. Great money from the state government, but, we've now hit a bit of a roadblock. QUT is committed to keep the portal live and executed. We're still working with Suncorp, who are doing lots of A/B testing on different messages, and we've been able to prove that a resilience message outperforms a deficit message every time, which is fantastic. But yeah, we've run out of money. We actually do want to do a field trial. We actually want to scale it up. So if there's anyone interested in partnering with us, I know that we've been speaking to the beta unit at Prime Minister and Cabinet, and hello to the people online from that department. So yeah, it could be as big or as small as what we want it to be. It could be a different age cohort. It could be for with Indigenous women. There's many ways that we could do it. We've certainly got a working portal. So if anyone in any way is interested, we want to keep it alive. We spoke at Parliament House recently on in a housing summit, but the emphasis at the moment seems to be very much on crisis, and absolutely there is a crisis. The problem is if we don't also think about prevention at the same time, we're just going to be looking at building houses and dealing with the crisis for forever. We're going to be chasing our tail. So we have to commit to prevention at the same time. So at some point that crisis starts to be alleviated, and then the prevention approach kicks over. So I'd really love it if somebody would step up and go, we need to do prevention in housing now.
Thank you, Rebekah. Anybody has another question?
Thanks so much, Rebekah. This is a bit of a broad question, but I'm curious about your thoughts on the connection between vulnerability and intersectionality of issues. So we've talked there about homelessness, but how, when you look at intersectionality, what your insights there are?
Yeah, what we know from the literature is the greater the intersectionality, the greater the vulnerability. And there are all sorts of different combinations that you can get. So, yeah, the literature is pretty clear on that. And I think that's why we've always defaulted to demographic groups, because it's easier to identify that intersectionality from those demographic areas. But it doesn't necessarily mean that's, the only way. I think we do need to be looking at psychographics. And the fact is, we are all going to experience vulnerability in our lifetime if we haven't already. We've all been children, and hopefully we'll all be, older people. And so when we look around, there is no one vulnerable group. Everyone actually will experience vulnerability at some point. So when you design for vulnerability, you actually design for all. And so I really like the notion of inclusive design, because it actually picks up on that. But yeah, we know that intersectionality is a very clear indicator of potential problem.
Thanks, Rebekah. Do we have an online question anywhere? Just double checking that now.
No, we're good.
If not, anybody else with a question for Rebekah for this session? Just one from my perspective, actually, before we begin. The language issue is the thing that I think I struggle with, because I'm new to this as well, so I'm learning as we go through this process as well, which is part of the day. How do we maintain our focus on that strengths-based language instead of falling back into that kind of deficit-based language?
I think giving permission to others to critique us and not being defensive about it, and have it built into project processes. So I think if you've got templates that you're filling in at any stage, always, it's like put the reminder in there, but also have a checkpoint along the way to go, let's just check. And it's not just for strengths-based, it could be for a whole bunch of things. Things that are key criteria, key design principles of what you're doing, always return back to it and go, are we just staying on track here? Are we doing what we need to do? But strengths-based should be one of those criteria. And, doing that self-check and going, it's okay to not get things right every time. I look at some of my journal articles from even 5-6 years ago and sort of go, oh my God, I did it too. This is where we're at right now. Sometime in the future, it might change. So to quote an article actually I read recently by Maria, this is what I'm saying now, but don't hold me to it because I could change as I grow in the future. So this is where my position is right now. Could be different in the future. I hope I'm better in the future. Otherwise, what's the point if we're not all improving?
Thank you very much, Rebekah.